Okay, so this next stretch we're going to do is going to primarily focus on the spine, primarily lumbar and the thoracic spine region. It's sometimes hard to stretch this area just because either people are too tight or they're too limber with other movements. So the one we're going to show you is really good because it is isolating the back. So the first one we're going to do is we're going to work on one way. So you first start with putting one arm against the wall. You have probably shoulder height just there. Take your other arm, come out in front of you, and reach and push your shoulders into the wall. As you can see, I kind of slip because I'm on a rolling stool. It's better if you were either squatted or on stationary. But you can also force your hips back to where you started. You would hold it here for 15-30 seconds and then come back to the starting position. Now this next one I'm just going to explain because if I do it while I'm trying to talk, you're not going to be able to hear me. So you do the same thing, but you're going to go and you're going to actually face the wall. What I like to do or say is with your right arm or whatever arm is facing the wall, you'll make a rainbow and then you'll drive your shoulders, the front part of your shoulders into the wall so you're all demonstrate. And that one there, depending on your athlete or your patient, can feel it in the spine, but can also feel it in the shoulder because now you're stretching out the chest a little bit. So that one is primarily for the rotation of the spine, so for flexibility.
Okay, so this next exercise is a flexibility exercise for our cervical spine, which is the neck. This is one that can be done by yourself, or you can do a clinician one, which we're not going to demonstrate today. This is where they hold their head in your hands and you can passively stretch them that way, but we're not demonstrating that one. So this one today is a self-treatment option. You're going to stabilize one of your shoulders by putting your hand underneath your leg to stabilize this, and then you're going to pull the head laterally into lateral flexion. Hold that for about 15 to 30 seconds. There, you can switch sides and get that lateral flexion. And then for normal flexion, we go forward here and go until we feel a stretch there as well. This is good for the tight traps that most people have because of stress is often the cause of these tight muscles up here, and it's a great way to relieve those and increase our flexibility of our neck, which can be useful in many